Okay, so follow up on the wound again. So that's day 14. So this is the outside, what it looks like. As you can see, this thing's like I mean, I'm taking my shower, doing everything, and it's still holding, and it's still from the first time. So this is the advantage, and this is why I carry the Coban versus other dressings like gauze dressings like those Cling. Because clean would have never hold like that. If you ever have a clean dressing, it all get all scattered and stuff. And this is still holding. Obviously, here as I'm using a little bit more like to grab stuff and everything. It's a little bit on the outside. It still looks pretty good. Again, I put this piece of tape because obviously it loses his adherence a little bit, but I mean it's not going anywhere right now. So we'll open this and we'll see what's inside and show you and then decide the dressing. Okay, so the sponge has been doing his work, and this is why I wanted to change it, because I thought that the heavy part of emptying is done, and actually I was right. As you can see, compared to the other time, this is dry. This is like hard dry. This part is still soft, but this part here is dry. So basically what it's saying is that there's not enough, and actually you can see, let's see, put you on the side there. As you can see, there's a lot of kind of dry skin all around, and again this nice pink, but there's not enough fluid coming out like that versus the past. So that's why every time you need to assess, and that's why when I say I open my dressing and I'll see what it is, you need to assess the wound by seeing it. The dressing now is dry, so that means that I do not need the sponge anymore, because the liquid that is coming, so the exudate, that's what we call the liquid, is it's not strong. There's not enough exudate now to fill out a sponge like this, and this is getting dry. So the wound looks, even if it looks like kind of nasty a little bit as dry skin, but as soon as I'm going to put another, so I'm going to put another Aquacel, but this time I'm going to put a different dressing that's going to be a little bit more humidified. That's what I was trying earlier in the treatment of doing it. That's what I was trying to do, was to try to put it, and there was way too much exudate. So again, when I was talking about dressing before, not too wet, not too dry, this is what I'm talking about. So this now what I'm telling me is that my dressing is too dry, and this is why it's too dry. First of all, by touching the dressing, so I can assess, because by touching it right now, I can see that it's hardened. So that means, versus if you remember the last few videos, this was more like a gel, meaning that there was enough fluid still to go through it without having all that. So now I'm going to apply the Aquacel himself, and I'm going to redo the dressing that we were doing before, meaning like a window dressing. So that way I'll be able to assess it, leave it this way, and it will probably be the last change of the dressing. So basically I'm going to put a Tegaderm like this, like we were doing before, and another piece of Aquacel just to keep this humidified. Because there is still a little bit, as you can see here, there's still a little, that's still a little bit of hole. Like here is all equal, and again, like I was telling you, closing from the bottom and then closing. If you remember in the last few videos, this was still kind of a lot of open. But now here actually I can even feel like there's an indentation. I don't know if you'll be able to see it on the video. Probably not, because there's so much dry skin. But I can feel a little lump. So there's still, I still need to fill that little space. And that's what we call a filler. This dressing, that's what it does a little bit. Just like if you would put also gel. Gel that I had before is a little, it's kind of like the grandfather of those dressings. Before we used to kind of put gel, so basically you would fill the gel. Actually that wound that I have, this is what I was using before. I used the gel, closed that, and the wound because basically what you do, you fill the space with the gel. So what the dressing do now, it's kind of, it does the gel, but also it used as a dressing. And again, that Swiffer thing that I was talking about. So basically any bacteria or any liquid is going to be absorbed in the dressing. So by putting the Aquacel AG, it's going to take all the surface of that little hole there, use it as a surface. But this time, because this is dry, it means that there's not enough exudate to wet my my Aquacel. Now I'm going to apply a little bit of saline on the dressing so that the dressing is wet before I apply it, and then after that I'm going to apply this thing, close it in, and then I'll be able to monitor straight through it. Should be staying with another hole like this maybe another 7 days, and then but again now I'll be able to monitor it because I'll have a clear dressing. That's what we call a window dressing, because this looks clear through it, so I'll be able to assess it. So this will be the dressing. I'm gonna clean that up a little bit, take off the dry skins and stuff, and we'll be back. Okay, so this is after clean up there. You can see there's still actually a little bit more bigger hole that couldn't see with the dry skin, but that's what it looks like. It's nice pink, solving. This is the Aquacel with the gel. So you see how it makes like a little gel when you put some water on it. Well, water, saline. And this is how it's gonna go. So then after that, all I'm gonna do is apply this, and actually let's see if we can do it. Don't know how that well it's gonna work, just so you see how it works. So those comes with two things. So this things stick to this, and so there's one part. So here's the non-sticky part, and this is the sticky part. So all you do is basically you go in the middle of your thumb. I'll try to get a little bit more so I can catch. Okay. And again, see, much easier when you have someone else to do it with you. And then you just close on one hand, and you leave those little plastic thing when you do this. Some don't have it, but it's much easier with those ones actually, because it kind of gives you a surface to work with. And then all you do is basically make sure that you close it as much as you can. And then after that you take off. So there's a, see, a little part that's kind of separate. So what you do after that is you take off, obviously, because now I'm on video, it's broken down. But after that you take off this part. So now what you're left with is this. So when you see what I mean by there's window dressing, and all you do basically after that is, so technically this would be the dressing, but obviously, I mean, if I don't mind changing this all the time and stuff, which is not so good for the dress, but I could leave it just like that, because now right now nothing can get in, and all the perspiration of my thumb and stuff would be able to come out. The only problem with this is that as you do your normal task and things like that, this will rub off and stuff. So all I'll do is actually we'll cut that even smaller, and then I'll just kind of rub it right at the bottom just to hold it a little bit and protect it, but without kind of covering this. Also, if there's any liquid kind of coming, because obviously this is where your dressing, it's not so much that here is going to come out, but this will roll as it loses because I'm trying to leave this for another 7 days. So obviously those corners there would raise. I forgot to bring it, but you have other material like Kevlar. If you put that on there here, then that means that it would stick a little bit longer. So what I'm going to do is, like I said, take a piece like this, cut it in the middle, roll it right at the bottom here, and all like this.